I'd now like to call on Congressman Leonard Lance, a senior member of the House Energy and Commerce Committee. Congressman Lance has been instrumental in passing key mental health reform legislation and is a supporter of community mental health centers. Read over to you.
Thank you. And by the way, I forgot to give this to the governor, but some water for you if you like. The governor didn't seem to need any water. Well, thank you so much for being here, Mr. Congressman. I appreciate it. You were one of 20 Republicans to vote against the the House version of the ACA repeal. First of all, take us through that decision.
I guess that's why I'm not at our conference meeting that's occurring right now. I chose this invitation over our weekly conference meeting, which meets always the morning after we come back into session and is occurring right now. I was persuaded by the CBO score, which came out, and I don't know whether it's exactly on target, but I think it's in the ballpark, and I'm not one who disparages the CBO. I don't think it's perfect, but I do think that it is a guide for us. And then what came out of the Ways and Means Committee included refundable tax credits, but I don't think they were generous enough for Americans to purchase meaningful health care policies. And so those were some of the considerations. And then as well, what came out of the Commerce Committee on which I serve included no denial of coverage based upon a pre-existing condition, and that was modified by an amendment on the floor of the House, and I don't think it was modified in a favorable fashion. Beyond that, New Jersey is one of, I think, 31 states that expanded Medicaid, and that really is, in my judgment, a separate and distinct issue, and we should examine the fact that Medicaid funding is moving in a direction where we have to be careful about it. But I think that is really a different discussion from the discussion of the ACA. The CBO suggested when the ACA was passed that more Americans would be covered under the exchanges than under the expansion of Medicaid, and that actually has not occurred. There has been more coverage based upon the expansion of Medicaid, and as your audience undoubtedly knows, there are now more Americans insured under Medicaid than under Medicare, and that is vastly different from what had been anticipated. And so I do think we have to examine that long term, but regarding the ACA, it does need major revision in my judgment, particularly regarding the exchanges. I'm not one who says the exchanges are failing, but I do think the exchanges are not doing very well. New Jersey, for example, originally had 5 insurers in the exchanges, and now it's down to 2. And there are about 1/3 of the counties in this country, not 1/3 of the population, but 1/3 of the counties, largely in rural America, where there is only one insurer. And I do think that we should address that, and I hope we can address that in a bipartisan capacity. And I would like to hope that our Democratic colleagues would come to the table and work with the current majority, because I do think major revision is needed.
So you mentioned bipartisan reform, which is something that even Senator McConnell has suggested. But at this moment in our politics, is that possible? Is it possible for the ultra-right and the ultra-left and the hyper-partisanship that we face right now to actually get people together at a table or in a committee hearing?
There's certainly those in the conference, in both the House and the Senate, who are to the right, as there are many Democrats to the left. But I do think that there is the sensible center. I'm a moderate conservative. I'm proud of being on the conservative side of the continuum, but I want to work with the moderate Democrats, with those who are willing to come to the table. I was concerned that President Obama really was not interested in reforming the ACA, and I hope, based upon this experience, that President Trump will want to work with all of us in Congress. And there have already been preliminary discussions, very modest discussions, and I want to be part of that. And I do think there is the responsibility of working together. This is a partisan city. For example, we often do not work together, but there are other areas where we do work together, and the best example of that last week was the passage in the House of National Defense Authorization Act. It received wide bipartisan support. That doesn't mean that all of my Democratic colleagues supported it, but in the New Jersey congressional delegation of 12 members in the House, I think 9 of us supported it, and that included several Democrats, as an example. And so we do work together on quite a few issues, but obviously that doesn't get the publicity when we don't work together, and there are too many times when we do not work together.
What was the mood in the House Republican Conference as the Senate was crafting behind closed doors the ACA replacement?
Since we had gone through that travail, we observed as the Senate was discussing the issue, and I think it's been said, health care is hard. And serving on the Committee of Jurisdiction, the Commerce Committee, yes, health care is hard. Given what has happened in the Senate yesterday, I hope that this provides the current majority, of which I am a part, the opportunity to suggest that our Democratic colleagues come to the table. That was not true in 2009 and 2010. The end product did not have Republican support. And of course, those who analyze the situation can determine why that was the case. I think it would have been better if the Obama administration had worked with Republicans in Congress. Now, of course, the Obama administration will say that Republicans in Congress didn't work with the administration. I recognize that. The proof of the pudding is, however, that there was no Republican support. There had been Republican support in 1935 for Social Security. Franklin Roosevelt made sure that there was some Republican support, even though in 1935 he had significant majorities in both the House and the Senate. And for sure, Lyndon Johnson made sure there was strong bipartisan support in 1965 for the enactment of Medicare and Medicaid. They were masters at developing a consensus, and I would imagine in the modern presidency, historians look to Franklin Roosevelt and to Lyndon Johnson in the expansion of social programs to the benefit of the nation. Both of those presidents recognized that it was critical to have some sort of bipartisanship. Let's move forward. Let's not rehash 2009 or 2010, and let's not rehash what's just happened. Let's not be in a position of saying we shouldn't work with Democrats, and let's hope that Democrats will work with us. I noted this morning in some of the morning television shows that some of my Democratic colleagues, not all, but some were gloating. I don't think that's appropriate. I think the issue is much too important, and I hope that we can work together on this important issue.
So as you're moving towards some kind of fix to the ACA as it exists now, what's the mental health piece of that? How should the ACA better address the mental health challenge and crisis that we're facing today?
I have worked closely with colleagues on the committee regarding the mental health issue in a bipartisan capacity. Doris Matsui, a very close friend of mine from Sacramento, California, bi-coastal, bipartisan, and we have passed legislation on the Demonstration Act regarding the mental health issue. But I want to make sure that as we discuss any further revision in any statutory law, not just the ACA, but any other statutory law regarding the better health of the American nation, that mental health be at a parity with physical health. I obviously see no difference between mental health and physical health. The better health of this nation requires that the Congress address both halves of the issue of making sure that the American people have the best health care possible.
Gotcha. You served in New Jersey State Legislature before coming to D.C., and I assume you keep a pretty close eye on what happens in the state.
I have a tendency to read the morning papers in New Jersey, yes.
Good. So you've heard of this Christie guy.
I know Governor Christie. I know his wife. I've been introduced to their children. Governor Christie and I do share a political party. I'm not sure that anyone would confuse his personality with mine or my personality with his. And he has a very vigorous personality.
I was confused as to whether or not 15 was the percentage of his approval rating or the number of people who still approve of him. Sorry, too soon. Too soon. But tell me.
May I respond to that? I saw something this morning to indicate that his percentage of approval is somewhat higher than that. Let me say that we've had 8 years of a Republican governor in New Jersey, and certainly he has tried to reform the property tax burden. That's a very difficult issue in New Jersey, and he has addressed to some extent our very significant pension issue. But we will be electing a new governor in November. You've just had the governor of Virginia, who, when you asked about the two candidates who might succeed him, I didn't hear much about Mr. Gillespie. I heard a great deal about the lieutenant governor. I know Mr. Gillespie, and he would be a fine governor. That's not suggesting the lieutenant governor would not, but we as well will be electing a new governor in November.
So what has happened, I told a bad joke, I'm sorry, but what has happened in New Jersey to address the mental health crisis? What has the state done that's new and innovative?
The legislature continues to work on this issue, but I believe that New Jersey is one of those states that is ahead of the curve in relationship to other states across the nation. At the moment in New Jersey, we're dealing with the opiate crisis, and I know that that is not necessarily mental health specific, but I do believe that there is a component related to mental health. And New Jersey, as is true of other states, is deeply concerned about the opiate crisis, and the governor of New Jersey has been put in charge of a task force on that by President Trump. Mm-hmm. I know that's not mental health specific, but certainly I'm sure that everyone in the mental health community recognizes that this goes hand in glove. Mm-hmm.
Are you worried about the fee-for-services funding cuts that took place in New Jersey this year?
Yes, I am, and that is an example of the fact that we have budget difficulties in our state. Our budget difficulties are, I suppose, state-specific, but we have borrowed too heavily in New Jersey without voter approval, and our pension system for public employees is in very poor shape, and that has an indirect effect on programs related to mental health, including what you suggest. This will be a very difficult issue because we have underfunded our pension system, our state pension system, for about 20 years, and I don't want to go into all of the details, but I warned about this when I was in our state legislature. Mm-hmm.
We talked with Governor McAuliffe about prisons and their role as sort of a last resort for mental health care. What's the role of the federal government? What's the role of Congress in changing the relationship between someone with mental health problems and the criminal justice system?
We incarcerate far too many people in this country, and regarding non-violent criminal activity, I think we have to examine that. The junior United States Senator from New Jersey, Cory Booker, formerly mayor of our largest city, the city of Newark, has been taking the lead on this issue here in Washington. And we have to examine as a society the fact that our incarcerated population is greater than most industrialized societies. And many of these offenses are related to drug use. And there is, unfortunately, in far too many situations, a mental health component that is not well addressed in prison. And I think it's the responsibility of state governments by and large, but also I think we at the federal level have to recognize that we have to be working on this issue. And these issues are all related. They cannot be separated. They have to be considered in the context of the greater whole.
Mm-hmm. You mentioned earlier that the preliminary discussions on some kind of solution to the ACA have begun. Can you tell me about those discussions? What's the framework for the beginning of the debate?
We haven't identified what we should do, but there are several of us who are working in a bipartisan capacity, recognizing that it was unlikely, in our opinion, that the Senate would pass the House legislation or legislation similar to the House legislation. Now, that was purely anticipatory, but given what happened yesterday, it seems to me that that's going to occur. I don't want to get ahead of myself. Perhaps Majority Leader McConnell will put up a vote in some way on this issue. There is a suggestion he might put up the House bill. I don't imagine that that would pass. And then there is another suggestion that there might be an attempt merely to repeal the ACA. I don't count heads in the Senate, but I can't imagine that would pass. And I would not be for that if that were to come to the House. Now, regarding what we should do in a bipartisan capacity, it seems to me we should look at the issue that the exchanges are not doing well. And there should be competition. And one of the other principal reasons that I didn't vote for the House version is that I don't think it led to competition and to the lowering of premiums for those who had already been covered. Many more Americans were covered, largely through employment, than not covered. That doesn't mean we shouldn't address those who were not covered. But premiums have increased on those who were covered, and that is a very significant issue in this country, and I would hope that Democratic colleagues would come to the table on that. But to answer your question specifically, we have not yet decided what way to proceed, and the action yesterday in the Senate, I think, makes it imperative that we try to come together.
Mm-hmm. I'm going to ask him one more question, and then I'd like to hear from the audience, and I won't make the same mistake that I did with Governor McAuliffe, and we'll get more than just one question. Governor Christie had one position on the ACA during, as he ran for president, but New Jersey also expanded Medicaid. What was he telling you during the debate over health care? There were a lot of Republican governors who wanted to keep the ACA, or at least fix the ACA rather than repeal it. What was Christie telling you?
I don't divulge conversations I may or may not have had with the governor of New Jersey, but the governor did state publicly that the House version of the legislation regarding the Medicaid expansion might be problematic for New Jersey. This is the anomaly, however. On the expanded Medicaid, that is for the working poor. The match is 90%. The federal government pays 90%, the states pay 10%. For more traditional Medicaid, this is for pregnant women, children, the disabled, the blind, senior citizens in nursing homes. The match for New Jersey is only 50%. And so you have the situation where for one classification, the match is much higher than for others. It's further complicated by the fact that although the ACA required states to expand Medicaid, as you know, the Supreme Court ruled that provision of the ACA to be unconstitutional, so not every state expanded. So you have here on Capitol Hill members of Congress from states that did not expand, large states, for example, like Texas and Florida and North Carolina and other large states, and their taxpayers pay for 90% of the expanded Medicaid population. I indicate to my colleagues why I think that that's not unfair, because New Jersey is a sending state, not a receiving state. Mm-hmm. I must say that argument has not necessarily persuaded all of my colleagues in Texas and Florida and other states, as you can understand. And so that is an anomalous situation, given the fact that the same day that the Supreme Court declared the ACA constitutional as a tax, not under the Commerce Clause, as a tax, it declared unconstitutional the forced expansion of Medicaid.
Gotcha. All right, let's turn to questions here. We've got this young woman up here who I missed with Governor McAuliffe, but I didn't miss it this time.
Hopefully you'll be able to address the question. It's pretty much the same. Will the rediscussions over the ACA, are you looking at expanding or reaching out to all the states for the Medicaid IMD exclusion? It's right now a demonstration project in 11 states. I'd like to see it fully repealed. It's discriminatory. I believe that it actually has incentivized non-care in hospitals when people really needed hospital treatment, and I'd like to find out where the discussions are in regards to the Medicaid IMD exclusion.
Thank you. It's an excellent question, and I'm unable to answer your question because I don't know yet whether this will be included, but I'll certainly take to my colleagues the fact that it's been raised this morning, and I understand your point, and I would hope that we might be able to address that. It's not clear to me how much we will do, given the fact that the House-passed bill had quite a few different components, and the Senate bill that has never reached the floor also had a lot of components. And so I would imagine the discussion would be, should we concentrate specifically on only a couple of areas where there might be agreement between Republicans and Democrats? And I don't know yet whether your area would be one of those areas, but certainly it's worth examining. And I'm sorry I can't be more specific, but the announcement was only last night from the Senate, and so I think we're in a new situation this morning from where we were, including last night.
Other questions? Got one over here.
Rep. Lance, thank you for being here. I would like to ask, first, if you can tell us why the ACA was not considered in a more public manner, and will you commit to advocating for those of us in the room who I'm sure would like to see this, that if an ACA reform piece of legislation comes before your committee, will you commit to advocating for public hearings?
I think public hearings are in the best interest, and I think that's one of the reasons that the legislation did not move forward in the Senate. And as you know, the ACA took a significant period of time, 2009 and 2010, and I certainly would hope that we might have public hearings moving forward on what we do next. I think there was a debate in the administration and on the part of our leadership as to whether we should tackle health care reform first or move first in the area of perhaps tax reform and an infrastructure bill. The decision was made on health care, and that's why I think the legislation reached the floor of the House when it did. Looking retrospectively, perhaps it would have been better to address tax reform and maybe infrastructure as part of tax reform first, although tax reform is a very difficult issue, and when we last tackled it in a systemic way in 1985 and 1986, that took 2 years as well. And so we can all be Monday morning quarterbacks, but I would hope moving forward that there could be hearings in both the House and the Senate on the health care issue.
I think we got time for one more. Anybody else? Anybody else? Ah, got one right over here. The microphone coming this way.
So thank you for supporting mental health. A question for you. I don't think we should consider tax reform and health reform as totally separate things. There are things that can be done in tax reform that will advance the agenda that you're talking about here, and I hope that's on the agenda as you go forward here.
Well, thank you. That's an excellent point. And yes, obviously, as we try to examine fundamental tax policy, since health care is such a significant part of the American economy, yes, this should be included in the larger whole. There's some discussion now, I suppose, as to what version of tax reform we take up, whether it should be both on the individual side and on the business side, or whether we should do the business side first. And since I'm on Energy and Commerce and not Ways and Means, I tend to deal with the issues related to what we've been discussing this morning. My colleagues on Ways and Means are undoubtedly discussing this morning, given what happened regarding health care last night, as to whether we should move directly toward tax reform, whether it should be all-inclusive, is that even possible? And you make the legitimate and valid point that tax reform in part includes a continuation of health care reform.
All right, Congressman Leonard Lance, thank you so much.
Thank you very much.